Hello, I'm Dr. Shalini Tiwari. I'm a gynecologist working in Delhi for last 20 years. So today is World Cancer Day. I'm so delighted to be amongst women entrepreneurs from whole all over the India. And I really want to share my insights about the cancer on this World Cancer Day. Cancer is such a frightful word. Anyone who hears cancer is like, oh my God, cancer, my life is gone types. But what I want to tell you is, with recent advances and so many progress in science, so much of new inventions coming in, the life quality with cancer also has become very good. So what we need to know is that awareness is needed. Awareness about prevention is needed. Awareness about what type of cancer it is needed. Awareness about the treatment is needed. That treatment exists. This knowledge is really important. And awareness about the right doctor. You just cannot go to any doctor to treat cancer. You need to go to specialist. Science is so advanced that it is a separate line altogether known as oncology today. So, on this World Cancer Day, I would like to tell you, please don't get scared with cancer. Secondly, let us see where do we stand as a nation in this world. You will not believe that 25% of the total cancer deaths happen in India. Isn't it a large number? Yes. And why does it happen? Do you know this? Not because India is a poor country. This can be one of the reasons, but the main reason is awareness is not there. Awareness when to go to a doctor, awareness that this could have been prevented, this disease could have been prevented is not there. So again, the answer is awareness and knowledge about the disease. Second most important thing is that we have a tendency to remain in denial. We should not be in denial. Once the disease is there, once we know that it is preventable, we should go in for the test. Like I would like to tell you, for example, today I'm on a women's platform. So let me just talk about the prevalent cancers amongst women. The two most common cancers which are prevalent amongst women is breast cancer and cervical cancer. Breast cancer is the leading cause of death in women as far as cancer is concerned. Can you beat that? And cervical cancer, again a women cancer, is the second most leading cause of death in women cancer patients. And the beautiful point about these two cancer is, I know it is a paradox, but I'm talking beautiful and cancer, but the point is that both of these cancers can be detected in early stage. Can be detected in early stage. Please underline this in your mind. All you need to know is how to detect it. Second thing, cervical cancer. This is the only cancer amongst all men and women which can be prevented, which can be prevented through a vaccine. A vaccine is there which if we give, we'll prevent it. So today, most importantly, I would really like to talk about these two cancers, breast cancer and cervical cancer, because we can prevent it, we can treat it. The quality of the life can really be made good against what people generally think that what it can be. So let's talk about cervical cancer. There is a particular virus known as human papilloma virus. Human papilloma virus is a sexually transmitted virus, and once it comes, it sits and can cause cancer later on after 20, 30, 40 years. It is a very high risk virus for cancers. Now, how many of us know that there is a vaccine exist to prevent HPV transmission? How many of us know? Number one question. Number two, amongst all of the females who know, do you know what is the cancer? What is the rate today? How much women have taken the vaccines? Only 1%. Only 1%. Imagine. So even if we know, even if we are educated, even we are like independent, financially independent, emotionally independent, and we say that we are okay, we are today's women and liberal and whatnot, but only 1% of the women have had HPV vaccine. Other than vaccine, there are screening tests, just like anyone does their blood test, as in BP test and lipid profiles and KFTs and LFTs. There are specific gynecological tests which are there to screen women whether they are on high risk for breast cancers or high risk for cervical cancers. These are very small tests, not very costly, not painful, but we just don't feel like getting it done just because we are in a denial phase. Why? We are also human beings. We can get into cancers. So please, if you are healthy, only then you can keep your family healthy. If your family is healthy, only then you can be productive to the society. So please get your screening test done. Let me name them here. Screening test means LBC or pap smear, HPVs, and colposcopies. These are three screening tests which we do for a female post 35. Every 3 years, we need to get a pap smear done. Every 3 years, we need to get a pap smear done, even if you are perfectly normal. Don't think nothing can happen to me. भगवान जी से कोई लिखवा के नहीं आया है. Please don't think nothing can happen to me. Every 3 years, you should get your pap smear done. Pap smear normal, colposcopy normal, whatever it is. Don't forget to get HPV vaccine. There are two type of HPV vaccines which exist. One works against 2 strains, one works against 4 strains. But both the vaccine covers HPV strains which causes cancer. So please get vaccination done. Please get your screening test done every 3 years after 35 years. Plus, if you have any symptom, now this is the second part of the awareness, knowledge of the symptoms you have, so that you can go to a doctor and identify the disease is identified at the right time. Okay, I'm sorry to take a break. There is a question here which I would like to take. What is the most common presenting symptom in the cervical cancer? Okay, I was just about to take this. Thank you for the question. See, the most common symptom is a postcoital bleed. Postcoital bleed means bleeding after a women have intercourse. So if women is experiencing bleeding, minimal or more, that is a second question. But if women is having bleeding post intercourse, that means she should definitely get her screen from these tests and she should undergo a biopsy if there is any doubt. Confirmatory test is only and only biopsy. Biopsy can confirm the test, but 80-90%, if the doctor is fully trained, we can see under colposcope and we can say that, okay, this is going towards cancer, cervical cancer. So the ideal thing is routine examinations, which is every 3 years. Supposing till now you have missed the examinations, please go to your gynecologist, get the basic screening done. Okay, does the diet affect cervical cancer? This is the second question. On a larger scale, diet doesn't affect cervical cancer, but definitely cancer as a whole affects body more, which is unhealthy. Which is unhealthy means body which has more comorbidities. Like if a body, but there are two patients, one is obese patient and one is normal build patient. Obese patient will be troubled much more than the normal build patient. Supposing patient is have diabetes or patient has hypertension, so any comorbidity will have more trouble from the cancer than the normal build. So directly it does not affect, but you should have healthy diet. You should have antioxidants which are present in fresh fruits and vegetables, and please be rest assured that it doesn't contain much pesticides, which none of us can guarantee. But still, healthy diet always give your body better strength to fight any disease. Directly, no diet can cause or is a high risk factor for cervical cancer. Okay, so what are the high risks? So let me go ahead. Like, what are the high risks for cervical cancer? High risk for cervical cancer is multiple sexual activity, is a why? Because if you are in multiple sexual activity, you're more likely to get cancer. And again, let me tell you one more thing about human papilloma virus is that this HPV virus is not contained by protected intercourse of barrier contraceptive like condoms. Even without condoms, with condoms, HPV can be transmitted. So don't think that you always had a protected intercourse. So about cervical cancer, two main things. Number one, screening test every 3 years. Number two, HPV vaccines. Number three, these vaccines are given from 9 years onwards. So please today take your sisters, take your daughters, take your colleagues, take your female friends and tell them that you must get vaccinated. And the first step is first you get vaccinated, then only you can convince the other person to get vaccinated. So this is about cervical cancer. Let's come to breast cancer. About breast cancer. Breast cancer, agree it doesn't have any vaccine, but it has a very important and a very simple method to detect. We females should have a weekly or a monthly routine to palpate our breast. And I just want to tell you how to do it. It is very important. You should, while taking bath weekly, make it a Sunday routine or make it a monthly routine from your palm of your hand, not from the pulp of your fingers. Like this, you don't have to palpate your breast. You have to palpate your breast like this. Can you see? I hope I am there on the screen. You should palpate your breast from here, like this. Okay, and you have to go till the underarms area. Keep on palpating. Anything abnormal you feel, please go to the doctor. And when you feel it weekly or monthly, you will be knowing what was normal for your breast and what size was normal for your breast. So whenever you feel something abnormal, please go to the doctor. This is known as self-palpatory method. This is the first step of diagnosing cervical cancer. At any age, any means be it young, 20 years, 25 years, be it old, 60 years, 70 years, 80 years, from any year of age, sir, you can have breast cancer. You can have the first diagnosis of breast cancer. Don't think that you're 75, you cannot have breast cancer. This is not possible. This is not there. So please have self-palpatory. Get this method into your daily routine. Second thing is, just like cervical cancer has screening test, breast cancer also has screening tests. So after 40, you must get mammography done every 3 years. Mammography every 3 years. Please underline, this is very important. Breast cancer is the leading cause of death. Leading means the first cause of death through breast cancer in women in India. This is very important. What age? Okay, I have another question. It says, what age does breast cancer develop? That's what I said. Any age can have breast cancers. Breast cancer, definitely, there is one risk factor which says that when you do breastfeeding, chances of breast cancer decreases. So in today's world, when marriage age has increased, when 2020 has become 30, when pregnancy age from 21 has become 31, and people are getting females are getting pregnant even post 40, they are getting pregnant, and then due to career they are opting for not to breastfeed. The breast cancer incidence have gone up. See, we cannot judge anyone. We should not tell them to change their lifestyle, but then there is a time decided by body clock, by nature clock, and by God. So just in case, if you're opting for a later childbirth or in your later age group, please, I would suggest, please don't forego breastfeeding. It is better for you and it is better for your baby. Second thing is, please incorporate these palpatory methods of examination and screening test of mammography. Don't forget these things. They are really, I would say, essential to a women's life. So these are two leading cancers. There are other cancers also in women, like ovarian cancer, uterine cancer. Talking about ovarian cancer is a silent killer, a gradually growing thing, difficult to pick up unless patient comes and we get an ultrasound done. So I generally tell my patients to incorporate ultrasounds also in their screening test. So after 40, I tell females, please get an ultrasound done yearly at least, or 2 yearly, you must get it done. Please get ultrasounds, so that anything developing inside your body which is probably not causing symptoms, we can come to know. Is breast cancer, okay, I have another question, is breast cancer an inherited disease? It is not an inherited disease, but definitely it is a it depends upon genes. It is a genetic disease. There's a difference between genetic and inheriting, but definitely genes, we the science have discovered there are few particular genes which are responsible for this. There are few particular mutations which are responsible for this. So if mother has breast cancer, rest assured that female has, the daughter has to be on guard throughout her life, that she also might develop breast cancer. So if a mother has, or a masi has, or a grandmother had breast cancer, then all females in the progeny should be very carefully screened for the breast cancer. So I was talking about ovarian cancer. So ovarian cancer, I was on ultrasounds. Okay, so we should incorporate ultrasounds in our screening schedule. So so till now we have discussed three things: cervical cancer screening schedule, pap smear, HPV, colposcopy. Breast cancer screening schedule, mammography every 3 years post 40. Now third is ovarian cancer, ultrasounds yearly or 2 yearlies. And if you have any problem, please go to the doctor immediately. Fourth cancer is a uterine cancer. See, females are choosing to get married late. We are more exposed to pesticides, etc., to inorganic foods, which are little harmful to health. Antioxidants are less, then pollution is more. Everything in together, and plus obesity is on rise, diabetes is on rise. People are opting themselves that let's not have children. So these three factors: no child, diabetes, hypertension, and obesity. These things are high risk factors for uterine cancer. So any female, if have all these 3 4 factors, please get your uterus screened regularly. How to get it screened? Again, ultrasound is the answer. Though ultrasound we don't like write as in screening test, but now that I'm telling you the high risk factors, please get your ultrasounds done on regular intervals. Or any bleeding abnormality you find out, please don't delay it. Don't be in state of denial that I'll take. And rest assured, as far as my knowledge goes, alternative medicine doesn't have cancer cure. Alternative medicine doesn't have cancer cure as far as my knowledge goes. So please go to your doctor. Even uterine cancer can be cured fully. Please understand, uterine cancer can be cured fully if diagnosed in the right state. You just need to get a surgery done and a small chemotherapy and you will be fine. So please understand, uterine cancer is also treatable, very nicely treatable. If you have these cancers, you can have a very good quality life. Is constipation an early sign of cancer? See, this is a very broad question. Cancer is not a sign of cancer per se. Right now, we are talking about women cancers, so definitely not. Maybe a colon cancer, which can be both to male and females, but right now we were not talking about them. But still, colon cancer can present with constipation, or if any cancer like uterine cancer or ovarian cancer, it has spread to the intestines, then it can give rise to constipations. So, for a cancer to cause constipation, it has to go to a very further stage. Okay, the question is symptoms to show. Sorry, I didn't read the question. Symptoms to know starting stage of breast cancer. That's what I told you. Please palpate your breast from the palm of your hand weekly or once monthly. Whenever you feel any lump growing or a small lump which was there since beginning and now the size is growing, or that lump has become painful now, any change from before, please understand you have to go to a doctor and get yourself examined. That's it. Any change in your breast while palpation. So self-palpatory method is the best diagnostic method for breast cancer. Okay, so we were on Okay, we were on endometrial cancer. Yes. So I was like, please understand that even endometrial cancer has a very good life. Ovarian cancer, I understand. Generally, it is diagnosed late. But if it is diagnosed early, please don't be reluctant in the treatment, because if we remove it and we'll give chemotherapy, the life quality is good. But I will agree that ovarian cancer is generally diagnosed late. It is a silent killer. That's why it is known as a silent killer. So there must may be a difficulty, but then the leading cause, the incidence of ovarian cancer is much less than breast cancer and a cervical cancer. We, on this cancer day, we must pledge that we have to make India a cancer mukt Bharat. We gynecologists generally say this slogan that this time we'll give a cancer mukt Bharat, means cancer free India we have to take. Is PCOD is early? No, no, not at all. PCOD is not a early sign of ovarian cancer. PCOD is just a simple form of lifestyle disease and a hormonal imbalance. PCOD is not a early signs or sign of cancer, ovarian cancer. Please understand this. It is just a hormonal imbalance. But here I would like to underline one thing, that obese people और ईस्ट्रोजन, जिन जिन लोगों में ईस्ट्रोजन एक्सेस होता है, conditions which increases the estrogen exposure in the body, like late fertility, delayed pregnancies, PCODs, obesities, increase estrogen may affect development of few cancers. These are hypotheses. They are not yet proved, but these are hypotheses that breast cancer can be in patients who have very high estrogen content or who are exposed to estrogen more, or uterine cancer can be in those patients who are exposed to estrogen more. That's why no baby, nulliparous woman is a high risk factor for endometrial uterine cancer. So PCOD per se is not a high risk factor for ovarian cancer. Okay, any more questions? I would just like to, again, I would like to please highlight 2-3 points. Very this one thing is that we have to make all girls vaccinated against cervical cancer. This is very, very, very necessary. So vaccination, prevention, screening, and self palpation and self value. Please value yourself, your body, and your health. It is very important. If you are healthy, only then you can keep your family healthy and your society healthy, productive. Thank you so much. If any more questions, I'm glad to answer. Thank you so much. Thank you.